And we have Dean Johnson and so many others here, Dr. Wade from the city, who are incredible advocates for public health, and it's really an honor to have all of them. This is not only a milestone for public health, but for health equity. I will never forget the moments walking around the corridors of this hospital in the spring to support our frontline healthcare heroes. We had over 300 patients in our hospital at that time, and almost every person had COVID-19. But you also couldn't help but notice that almost every patient in those rooms was a person of color. Now it has never been more clear that the health and well-being of this community we serve right here in Newark has a direct impact on everybody's health in this entire state and in this nation. And with that, I am so pleased to introduce our first speaker today. A member of the University Hospital family, Maritza Beniquez is a nurse hero in our emergency room. She will tell you more about her inspiring story, but let me tell you about her impeccable credentials. She graduated magna cum laude from CarePoint Health School of Nursing at Hudson County Community College in 2014. She then got her BSN from Chamberlain College of Nursing in 2016, and in 2018 she was nominated as a March of Dimes Nurse of the Year for her incredible work right here at University Hospital. She has always been an advocate for her community wherever she has been. And since she has been at University Hospital for the last 4 years, she has been an advocate for this community right here in Newark every single day when she goes to work. She was there on the front lines for the COVID-19 pandemic, and we will never forget that. Without further ado, Ms. Beniquez.
Good morning, everyone. I wrote everything down because with blizzard of cameras that's here, I get incredibly nervous. I find it really unnerving, but I'm going to go ahead with it anyway. I'm going to do it both in Spanish and in English because for me it's important that my Latino family understands what it is that's happening today. So, okay, I'll start. My name is Maritza Beniquez. I'm a Latina Americana, first generation, born here in the USA. I have three beautiful children, three wonderful children, and I'm grandmother to two. I've been a university nurse here in its emergency department for the last 5 years. My experience during this COVID pandemic has been pretty much the same that's been seen throughout the world, right, and across our 50 states. It's been filled with a sadness and a despair of the devastation that's been caused by this disease. We're a level 1 trauma. Our ER is busy on a good day. When COVID came, it was the worst of our days. It was our worst nightmare. It was just wave after wave of critically ill patients that were coming in with no end in sight. It was like watching a tornado or a hurricane cause that sort of devastation in the field, and instead of it being the buildings, it was our own people, our Black and Latino communities. I will never forget what this facility had to survive, what this city had to survive. And more importantly, I want to take a moment to express my gratitude to all of those that came to our aid in our darkest need. In our darkest hour, they were here, and that was our EMS workers that came in, and we had flight nurses land on the top of this hospital because our own staff was decimated. We had travel nurses come in from different states. We had the U.S. military, God bless them all, the U.S. military healthcare personnel that was here on the floor, boots up, to help us. They were incredible, all of them. And again, to all of our doctors and our residents, a few of them that we had to dress up as nurses and and have them do the job. But all kidding aside, we now stand at the precipice of a second wave, right? Hopefully not as abrupt as the first. But it's only complicated by the fact that we are approaching the flu season, and none of us, or I don't know what that is going to look like. I have no idea what that's going to look like. As a woman of color and a Latina, I know that we are 3 times more than likely to suffer the catastrophic catastrophic effects of this disease. So for me, it has been important to receive this vaccine, not just for me, but, for all of those that I love, my people that I love, my family, my friends, my community and my neighbors, my coworkers. That's the importance of this vaccine, because if we don't start now, and it's not even whether we don't start now, we have no choice. We can't afford to lose any more people. We cannot. So anyway, at this time, I'd like to thank our hospital administration, Jonathan Green, I don't see him here, but he's awesome, and for their commitment to this community, right? And I'm going to introduce Governor Phil Murphy, but only after I say this in Spanish. Hola, mi nombre es Maritza Benique, soy una latina americana de primera generación nacida aquí en los Estados Unidos. Soy madre de 3 bellos hijos y abuelita de 2. Trabajo en el Hospital Universitario de Newark como enfermera de sala de emergencia. Hace 5 años que estoy aquí. Mi experiencia durante esta pandemia de COVID ha sido lo mismo que muchos de mis compañeros de trabajo y de la atención médica hemos visto, ¿no? Al mundo entero. Fue lleno de tristeza y desesperación por la devastación que nosotros tuvimos que enfrentar y lo que esto ha causado en las vidas de tantas personas alrededor del mundo. Somos centro de trauma nivel 1 y normalmente nuestro hospital es tenemos una de las salas de emergencia más concurridas en el estado de New Jersey y en la ciudad de Newark. Pero esto fue otra cosa, esto fue muy diferente. Fue algo que nosotros nunca hemos visto en el pasado. Fue devastante. Esta enfermedad no le importó de dónde venía, ni quién eras, ni tu edad. Esto atacó a todos los caminos de vida y a poblaciones adultas. Era casi imposible de enfrentar o imaginar. Fue como ver la devastación de un tornado o un huracán que destruye todos sus alrededores, pero en vez de ser los alrededores eran personas, humanos. Nunca se me olvidará lo que esta ciudad tuvo que sobrevivir y lo que este hospital tuvo que pasar. Siempre sería agradecida a todos los que vinieron a nuestra ayuda cuando lo más necesitábamos. Todos el personal militar, las enfermeras de viaje, los doctores y todos los voluntarios que estuvieron. Ahora nuevamente nos encontramos en el precipicio de una segunda ola que se complica aún más por la temporada de la gripe. Como mujer de color y latina, sé que tenemos 3 veces más las probabilidades de sufrir los efectos catastróficos de esta enfermedad. Por eso es que es importante para mí el poder recibir esta vacuna, no solo para mí, sino para mis seres más queridos y para mis vecinos y para mis compañeros, para el mundo entero, porque tenemos que ponerle un fin a esto. Esto es, no podemos arriesgarnos de perder ni tan sola una persona más, si tenemos el poder de cambiar el futuro. En este momento me daría mucho gusto agradecer a toda la administración de este hospital, el doctor Anaha y el señor Jonathan Green, y a todos los que nos ayudaron a hacer este día posible, y sobre todo por su compromiso a nuestra salud. Ahora les presento a nuestro comprensivo gobernador. ¿Dónde está él? Phil Murphy.
Thank you, Marissa. Great job.
Thank you.
Well done. As we are outside, I'm going to have the courage to take off my mask here for a few minutes. Good morning, everybody. Let's hear it one more time for Maritza Benitez. More on you in a minute. Thank you, Dr. Sharif El-Nahal, for welcoming us to University Hospital, to your extraordinary team, and to you and your colleagues. Thank you especially for your leadership in getting these first vaccinations to our heroic frontline healthcare workers. I also want to give shout outs to the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. Judy, great to have you. Essex County executive, one of the finest leaders in this state, if not anywhere, Joe DiVincenzo. Joe, great to have you. Newly shot up Dean of the Rutgers, New Jersey Medical School, Dean Robert Johnson. Bless you, Dean. And again, to Dean Johnson and Sharif, an additional thank you for making University Hospital a site for the clinical trials for the vaccine from Moderna that is waiting on deck, hopefully to get an EUA as early as the next couple of days. This is a day we've been waiting for, almost a year for, and we're not going to let this moment go to waste. It was an incredible thrill to witness these first vaccinations. At my side was the First Lady of the great state of New Jersey, Tammy Murphy. We know this is not the end, but we know that we are witnessing at least the beginning of the end. And back to you, Maritza. Thank you, not only for your introduction and for setting the example for others, not just by being the first of our healthcare workers to be vaccinated, frankly, the first person in New Jersey to be vaccinated, but through your dedication to the health and safety of your fellow residents. To you and your colleagues, we tip our hat to you. I can't even begin to imagine what these past 9 months have been like for you, your colleagues, and your family. What COVID threw at you and at us was unlike anything we have seen in a long, long while in our state, including natural disasters. I have to say I'm going to be at Passaic County in an hour or so, and I want to give a shout out to County Commissioner Assad Akhtar, who's also with us and part of the University Hospital family. I am proud, Maritza, to you and your colleagues that New Jersey never left your side, and that we continue to fight hard to deliver the PPE and other vital equipment that you and your colleagues needed to save every life possible. And Joe, you were right there at every step of the way. And now that fight to protect every life moves in an entirely new direction. We are supremely confident in the safety and efficacy of the Pfizer-BioNTech vaccine. We are confident in the FDA's action and in the review conducted by the Vaccine Advisory Panel, which recommended that the emergency use application move forward. We are proud of Maritza and her colleagues here and at other hospitals up and down New Jersey who are putting their confidence on display by being the first in our state to receive this vaccine. And as more vaccine shipments arrive, and as we anticipate, as I mentioned a minute ago, Moderna's vaccine will also be approved for its emergency use, our vaccination program will become much more robust over the coming weeks. Our healthcare workers and long-term care facility residents and staff remain our top priority for initial vaccinations. But it is our hope that soon enough, our attention will be able to turn to vaccinating other frontline workers, vulnerable communities, and ultimately the general public. Should our plan play out as we have drawn it up, as one group of vaccine recipients receives their second dose, a new tranche of recipients will be receiving their first. Keep in your mind's eye basically overlapping waves. This overlap will allow us to ensure our vaccine progress. Yes, this is a day we're celebrating, but no one should be mistaken that we are still in for several hard months and we're going to be facing stiff headwinds from this second wave. I think the next several weeks, folks, are going to be really, really tough, and there's no way around that. Maritza and her colleagues still have new patients coming in every day that they care for and protect. But thankfully, they can now begin to do so with a higher level of confidence of their own protection. Bless you, Maritza, and all your colleagues. With that, please help me welcome another extraordinary leader, the Dean of Rutgers, New Jersey Medical School, Dean Robert Johnson, newly vaccinated, I might add.
Everyone. And as the Dean of the school, let me formally welcome everyone to Rutgers University. We are proud that we have been able to play such an important part in making sure that we're able to move forward in this very, very important health issue. I've been a practicing pediatrician at New Jersey Medical School and University Hospital for nearly 50 years. And in all that time, we have hand in hand tackled many major health issues in this city. HIV, lead poisoning, hepatitis A, teenage pregnancy, on and on and on. And we have been able to work together to bring excellent health care to the people of this city. And it's no surprise then that as we tackle the biggest thing that's ever happened in any of our lives in health areas, that we again worked hand in hand. On the scientific side, developing some of the first tests for COVID-19, and Dr. David Alon and his center being one of the leaders in the country with the vaccine trials here in Newark to make sure that our Black and brown communities were represented in those trials, and not to mention the care that was provided in this hospital for hundreds of people who were infected, and being able to bring some of the newest advances in care early to the people of this city. So we have moved forward. We are now at a point where we are vaccinating members of our healthcare team. We are working together with everyone across the state to bring this to everyone else in the state. And it's wonderful to see that we're beginning to turn the corner. It's amazing that it's in such a short period of time, but it's great. It's terrific. The sun is shining. It's a wonderful day, and we are very, very happy. Thank you all very much. And now, who's coming up next?
You're going to go with, let me see here. Judy.
Judy.
I got to say one thing. It's very rare that this will have happened. Dean, thank you for that, and thanks for your leadership. Not that long ago, Judy ran University Hospital, and Sharif was the commissioner of the Department of Health. Fast forward to December 2020, Sharif's running University Hospital, and the woman who needs no introduction is running the Department of Health, Commissioner Judy Persichilli. And Dean Johnson's been the one constant.
It is great to be back at University Hospital. It is great. This is a historic day. And first, I have to thank the governor for being such a support to the public health structure in the state. We couldn't do this without your support and your constant questions and information that you're able to give every day. Thank you, Dr. Johnson and Dr. Elnahal, for hosting us today, and to the workforce here at University Hospital. Newark has been disproportionately impacted by COVID-19, particularly their communities of color, where we know that young Hispanic men are dying 3 times more than their white counterparts, and African Americans generally are dying 2.5 times more. It's the staff at University Hospital that every day comes in and saves lives. They celebrate when they save a life, and they mourn and comfort those they cannot save. And they go home every night, and they come back the next day and do it over and over and over again. Today marks the beginning of the end of them having to do that. Because today is a historic day, not only in New Jersey, but in our nation. The first vaccines are coming to life. On March 4th, we had our first case. Today, I stand before you, and we have over 400,000 cases in New Jersey. The availability of this vaccine within a year is nothing short of a scientific achievement that we have never seen in our lifetimes. We're starting phase 1. That includes the healthcare workers, all paid and unpaid healthcare workers who are at high risk for coming in contact with infectious material. 6 acute care hospitals in the state have received or will receive today the first tranche of the Pfizer vaccine. Atlantic Care Regional Medical Center, Cooper and Camden, Hackensack University Medical Center, Atlantic Health Morristown Medical Center, Robert Wood Johnson in New Brunswick, and of course, the First University Hospital. By the end of the week, vaccines should be available at additional 47 acute care hospitals that are receiving the Pfizer vaccine. We are expecting 76,000 doses this week. 18 of our hospitals will receive the Moderna vaccine once the EUA is released. While acute care hospitals will initially be the points of dispensing for the vaccine, in a very short period of time, we will be announcing a network of community-based providers that will be available to all healthcare workers in the 1A category, whether you work in a facility or you work in the community. The clinical trial data shows that this vaccine is safe and it's effective at preventing symptomatic COVID-19. It has been reviewed by independent experts for both safety and efficacy. Additionally, our own New Jersey Professional Advisory Committee has diligently reviewed all of the data related to the vaccine trials. So vaccination is an important step to prevent this illness and the potentially devastating consequences of this illness. Today is the first step in a long journey. We cannot let our guard down. We must continue to mask, socially distance, wash our hands frequently. If you're sick, stay home, get tested. But today is the first step in a journey that seems like it started years and years ago, but it was less than a year ago, on March 4th, when we realized something was going on that we had never seen before. We're thankful to University Hospital and our other hospital providers for the work that they're doing, and all of the people in the community who are caring for individuals who are suffering from the consequences of COVID-19. I think now it's my distinct pleasure to introduce an individual who has been with us in vaccine planning every step of the way. I can't thank him enough for his support. I don't think he needs an introduction. He needs no introduction. County Executive Joe D.
Thank you, Judy, and thank you for all the support that you've given us in Essex County. We're going to have 5 vaccination sites, and all 5 of our sites are ready to go, and your staff has been tremendous. And to Dr. Armahal, we have 2 stars here, that are truly doing a great job when it comes to running a hospital and taking care of the health of the people of the citizens of New Jersey. And I want to thank both of you. You've been outstanding. This is a historic day here, not only throughout our country, but New Jersey, but here in Essex County, especially in Newark. And I want to thank Governor Murphy and Tammy for selecting Newark, New Jersey for this historic moment. The governor, and I say this all the time, what he has done since the beginning of this pandemic, he showed leadership and he brought people together. And I had my staff, if I didn't watch it every day, I had one of my staff members watch it, because he provided information to all of us and made us all feel very, very comfortable. He got us to this point where we are today. And we're going to continue to do this because this is not over yet. We still have a lot more to do. But we are in good hands with Governor Murphy and his team. He has a tremendous team. Essex County, Newark, out of the 21 counties, this is the county that is the greatest. We have the most positive infection. We have the most deaths. We have a lot of work that needs to be done here. But it's going to happen because we're all working together in Essex County. We're all working together in Newark to making sure that we do the right thing by our citizens. So even though this is a great day and we see light at the end of the tunnel, there's still a lot more to do, and I know Governor Murphy will be right on it. Thank you very much.
Love you, buddy. Thank you for that. Joe, thank you so much for your leadership, which has been extraordinary. I'm going to depart from the program for a quick sec. We're going to take a couple of questions, but very few, just because we're all a little chilly out here. We have miles to go. But guess what? It's Maritza's birthday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Maritza. Happy birthday to you. Little rock and roll there, man. Real quick, Dave. Judy, do you mind joining me? Yeah, I think the message, and Judy will correct me if I'm wrong here, we will, just like a stone in a pond, this will begin to ripple through, at first, as you heard, healthcare workers like Maritza and her colleagues, long-term care residents and staff, and then we'll go out from there to other essential frontline workers and vulnerable communities. I think, Judy, our working assumption is that we get to the general population by April, May. Is that we good with that? And I would say my message, our message, Dave, is to stay the course. Don't let your guard down. We're not flipping a switch today. Joe made the point, I think this is the beginning. Judy said this as well, the beginning of the end, but that's going to last a number of months. Please don't let your guard down. Please celebrate the holidays in small numbers with your immediate family. Anything you want to add?
Yeah, that's fine.
All right, Judy's good with that? Okay, that's a good sign. Please. Nancy, I didn't recognize you with the mask. Yeah. Yep, Maritza, come on up. The question from Nancy, what did it feel like to get the shot, and how are you feeling right now? Come on, right here, there you go.
I barely felt the needle go. I had to check to see if it went in. I didn't feel it. There's no pain. I feel great. I'm excited. I'm happy that, that in another 2 months, month and a half, I won't have to be afraid to go into a room anymore. I won't have to be afraid to perform chest compressions or to be present when they're intubating a patient and giving a breathing treatment that's necessary. I don't want to be afraid anymore, and I don't want to have that risk to take it home to my own family, to my own friends, and to my neighbors and people within my community. So I am elated. I thank you, Father God, for this moment.
Love that.
Yes.
I love that. There's no truth to the rumor that she could not have busted that dance move without the vaccine, by the way. Daniel, is that you? I'm having a hard time hearing you.
Me?
You going to disclose your
I'm
age?
56 years old, young today. Look at me. Beautiful.
They're getting it today, right? Other folks are getting it in the other 5 hospitals as we speak, right?
Yeah, of the 76,000 doses that we're getting this week, about 20,000 of them will be released for long-term care facilities. So it's coming in over the days. I don't have the exact number, but we expect by the end of this week 76,000 doses.
One thing I wanted to add to what Judy said, if you do the math, 6 hospitals today, 47 for more Pfizer by the end of the week, 18 Moderna next week. If you do the math, that's 71 hospitals, and that's the amount of hospitals we run in the state. Real quick, Brent. So I don't want to speak for Judy. I've said this publicly, and I mean it. I'm ready to go in there and take it, but I don't want to take it ahead of one of Maritza's colleagues or somebody who's a long-term care resident. So I don't have a plan yet, but I have no problem whatsoever taking this vaccine, and absolutely will take it.
Absolutely the same.
Same thing.
Frontline, most at risk, have to get it first.
We're getting clobbered by this storm, I fear, tomorrow afternoon into Thursday morning. We are very focused on logistical challenges vis-a-vis distribution. I don't have any specific more to tell you. Long time. Nice to see you, Brenda. Hi.
Yeah, I'm hoping by early part of next week. They get the 20,000 doses. That is a federal pharmacy partnership with CVS and Walgreens. We've identified what pharmacies will be handling what long-term care facilities. That's all been worked out. The doses will go to the pharmacies, and then the pharmacies will send individuals into the long-term care facilities.
I want to also make note that as a national matter, the person overseeing distribution is 4-star General, New Jersey's own Gus Perna. I want to thank Judy. I want to thank Joe, Dean Johnson. Maritza, bless you. Happy birthday. Sharif, to you and your team, thank you so much for having us. It's a great day for University Hospital, for Newark, for Essex County, for New Jersey. God bless you all. I'll see you around, kiddo.